So today we're going to be talking about leptospirosis. So just a table of contents to know where we're going to go with this. First, we're going to talk about what the disease is. Next, we're going to talk about the bacteria. Third, we're going to talk about how it works. Fourth, how do you contract it? Fifth, how do we treat it? And then sixth, some conclusions. So first, what is the disease? The nickname, symptoms, progression, and mortality rate. So there's a lot of nicknames. The most prominent one that I've seen is Wells disease, which is the most severe form of leptospirosis. But I also could appreciate the swamp fever, mud fever, and rice field fever. So just some common symptoms of the first phase of leptospirosis. You can have high fever, chills, vomiting, red eyes, diarrhea, headache, which this picture over here shows perfectly, megalis, which is just like muscle aches, jaundice, which is yellowing of the skin and eyes, abdominal pain, and a rash. And the incubation period can take from 2 to 21 days after exposure. So the second phase is a lot more severe. The second phase can also include jaundice, but it would be a mild elevation in the immune enzymes. The renal failure, which is kidney failure, which would cause sediment changes in urine. And then meningitis, which would be 5 to 13% of all meningitis cases, where the Leptospira DNA can be detected in the cerebrospinal fluid. The acute phase of the illness lasts 5 to 7 days and then is followed by a 1 to 3 day period of improvement, which is called the immune phase. And then the disease can last a couple days with just the acute phase, or it can last 3 weeks. And then recovery without treatment, which would be leading to second phase, could take months. So the mortality rate is relatively low with the acute and immune phase. You get a little bit higher with the more severe phase, but it's still relatively low at 5 to 15%. And then mortality in dogs is about 10%. So next we're going to be talking about what the bacteria actually is, its shape, gram status, the type of agar that we would grow it in, and the structures. So the shape is spirochete, and leptospirosis is the most widespread zoonosis in the world, which just means that it's the most common disease caused by animal to human contraction. The gram status is going to be negative. The agar type is the LVW, which will cause, it's a clear agar, and it'll cause small white spots, which would be concentrated of the Leptospira. The structures, it has internal flagella, and then it has structural proteins on the outside, which would be lipopolysaccharides and peptidoglycans. So the Leptospira is also 6 to 20 long. It's 0.1 in diameter. They're highly motile with their internal flagella. They're obligate anaerobes. Their optimal growth temperature is 28 to 30 degrees Celsius, and they'll produce catalase and oxidase. So next we're going to talk about how it works, its replication, pathogenesis, and outbreaks. So first, replication. The replication will start with a breach in the skin or ingestion of the bacteria. Then it'll make its way into the blood vessels and macrophages, or both. It will produce cytokines and antimicrobial peptides. It'll activate coagulation cascade. Leptospheres are bound to plasmin. Then they will degrade and inactivate the complement system, leading to clotting and degradation of the extracellular matrix. So this is just a picture of how this works, showing how from the epidermis to the dermis, it will penetrate the skin, get to the blood vessels, it will also get to the macrophages, and in this it will form blood clots and degrade the extracellular matrix. So next we're going to talk about the pathogenesis. First, the pathogenic leptospheres invade the intracellular junctions of the hosts, and then bile will leak from the caniculi, and that will cause jaundice. The liver enzyme elevation will cause liver failure. The leptospira bacteria reproduce in the kidneys and then are shed out of the urine, which is why we can do a urine test later to diagnose this. The cytotoxin causes infiltration of macrophages and polymorphonuclear cells, and the outer envelope of leptospiras possesses an antiphagocytic component, allowing the attachment to epithelial cells and preventing it from being phagocytosed. This is the most recent outbreak that I could find. It was in Tanzania. There were over 20 cases and 3 fatalities, and it started July 5th, 2022. The most common symptoms in this outbreak included nasal bleeds, fever, and headaches. And in the United States, we have approximately 100 to 150 cases reported every year. So there's about 1 million cases worldwide, approximately, and there's only about 60,000 cases that are fatal. So next we're just going to talk about how you would contract this. There's carriers commonly found, contamination, and how you would get it, the transmission. So obviously there's a whole bunch of rats on my slides, but why is this? So rats are carriers just like cattle, pigs, horses, dogs, and wild animals and other rodents would be. There's approximately 160 mammalian species that have been identified as natural carriers of the pathogen. So just another carrier slide. Animals can be asymptomatic carriers or can develop clinical infections which could be fatal to them. Spontaneous abortion is common outcome of leptospirosis in cattle, swine, sheep, and goats. So this would majorly affect farmers' lifestyles. So rodents are the most important reservoirs for maintaining transmission. So the rats are the most common. First, it would start in the utero, and then during birth, it would be passed on, and then from infancy to environmental contamination of the nest, so then the whole family has it. They're mostly asymptomatic carriers, and they can shed the organism in their urine intermittently or continuously throughout their life, contaminating the environment around them through runoff water and all kinds of other methods, which we'll talk about later. So these are just some of the most common areas that they would be found. Indonesia has a rate of 39.2 per 100,000. Latin America would be 2.45 per 100,000. Sub-Saharan Africa is 14.8 per 100,000. The Caribbean would be 51 per 100,000. Oceania would be 150.68 per 100,000. And South and Southeast Asia is 19.7 per 100,000. So predominantly in America, we see these problems in Hawaii, which is cases of 10 per 100,000, and Puerto Rico, which we get 4 per 100,000. And something you might notice about all these places we've discussed is a lot of them are tropical, where you'll find water, and we'll talk about why that is later. This is just a heat map showing kind of where those places are and the most prevalent rates. And we see a lot of them along where there's a lot of water. All right, so talking about contamination, organisms can survive for days to months in urine-contaminated soil and fresh water, and it can happen in several ways. Heavy rainfall, flooding, and hurricanes allows the mixture of this urine-contaminated soil or sewage with water. And areas with poor housing and sanitation sewage conditions that propagate high rodent populations, they definitely pose a larger risk. And animals' excretion of urine into wet soil or bodies of fresh water, such as ponds, lakes, rivers, streams, and drainage of urine-contaminated soil or water into bodies of fresh water would definitely cause contamination. So just transmission, how is this happening? How are people getting this? So humans are accidental hosts. They can get it through cuts or abraded skins, mucous membranes, conjunctivi, which is just your eyes, or ingestion of food or water. And then what is actually contaminated? Rat urine, rat reproductive fluids. Rare cases, they've seen animal bites. And more rare cases, they've seen where human breastfeeding and human intercourse can actually spread the disease as well. So our last big topic, how do we treat it? The risks, diagnoses, treatments, and prevention. So the risk factors, there's quite a bit here to look at. So occupational, we're thinking are farmers, ranchers, veterinarians, sewer workers, rice farmers, anybody that's going to be working around water that could be contaminated. Additionally, recreational, freshwater swimming, canoeing, kayaking. If you're going swimming and getting submerged in the water and you have a cut or you get it in your eye, that's an easy way that you could contract this bacteria. And then household ways, if you have pet dogs or livestock, rainwater catch systems, things like that, that could be infected by the rodents. So low socioeconomic status is also associated with this disease if you're living in overcrowded urban areas with poor sanitation. Travel, because we don't have such a high prevalence rate in the United States, a lot of times the places in the United States, the people in the United States who are contracting the disease traveled before they knew they had the disease, and then that's why the prevalence rate in America is that 100 to 150 range. And then other methods would just be like walking barefoot with a skin lesion, contact with wild rodents, or accidental laboratory exposure. So this is just a quick graph from a study in Hawaii that I found. So recreational use went down a little bit over the years of contracting the percent of leptospirosis. Occupational hazards went up, and habitational kind of stayed the same, went down and then a little up. So how would we diagnose this? So you can do general clinic laboratory findings, microscopic demonstration, antigen detection, isolation of leptospires, which would be like agar, serological diagnosis, or molecular typing. And there's all of those over here. And then how would we treat this? So the majority of leptospirus infections are self-limiting, and they don't have a high mortality rate, but they can be severe. Antimicrobial therapy shortens the duration of illness and reduces the shedding of organisms in the urine. Mild and severe leptospirosis both use the administration of antimicrobial therapy. Mild would use the oral doxycycline or oral azithromycin and also amoxicillin. Severe, you're going to want to use parental penicillin, doxycycline, and third generation cephalosporins. But we don't have to treat it if we can prevent it. So there's not currently a vaccine available, but avoiding potential sources of infection, those potential contaminated water places, and there is an animal vaccine that we currently have. Prophylaxis with doxycycline is reasonable for individuals with high likelihood that may have exposure to these environments. So they may take those medications if they believe they're at risk. So lastly, we have our conclusions. I added in some similar diseases, recommendations, and all of the species. So some of these misdiagnosed diseases, one's called dengue or break bone fever, which is actually caused by mosquitoes, but it causes some of the same symptoms. It causes the fever and the rash, and it's similar to the leptospirosis pathogenesis. And also the Rocky Mountain spotted fever, the mild leptospirosis can be treated with the same techniques. So actually a misdiagnosis in that sense might be okay, but severe cannot be treated with the same techniques. So getting a correct diagnosis with leptospirosis versus Rocky Mountain spotted fever would be essential for the severe cases. And then just some recommendations. Definitely raise awareness. I had never heard about this before I did this presentation. Improve surveillance, know what water is contaminated, what water is not contaminated, make sure that we can detect and treat people early. Safety regulations, make sure that when the water is contaminated that it's not going anywhere, that we can treat the water and then put it back into the system. And then hopefully come up with a vaccination and improved sanitation overall. And then there's a whole bunch of species of leptospirosis, so there's just this huge list here. And that's it.